Infertility has become a huge problem in the United States and worldwide. But did you know that there are actually well-researched root causes behind infertility? And addressing these root causes using functional medicine can allow both males and females to be able to become fertile again. So we cannot wait to dive into this topic with you and show you what is going on in the body, oftentimes when we're struggling with infertility. And Teesa, my colleague here, who also is a functional nutritionist at VivaWise, is going to explain what the research shows so that you can become empowered to improve your body and possibly be able to conceive naturally. So let's dive into it, Teesa. Thank you so much for being here. and and what is infertility exactly? Like, how does someone know when they have crossed that threshold to becoming infertile?
Right. It's officially considered no conception or pregnancy after 1 year of actively trying to conceive.
Gotcha. Okay. So someone can be trying for 9 months, not getting pregnant, and they're still not considered infertile yet.
Exactly. Or if you're just not getting pregnant, but you're not actively trying, also not really considered. We've got to be timing and trying and all of those things.
Okay, gotcha. And so if someone has reached that threshold, they've gone to that 1 year of actively trying, and they're not getting pregnant, what should they be thinking about? What should they be looking into?
Right. Well, there are four primary root causes for infertility. And so we want to consider all four of these. And so there's, an unhealthy egg could be the problem, or an unhealthy sperm, or an unhealthy uterus environment for that egg to develop. And or there could be psychological reasons, stressors, whether they're internal stressors or external stressors that are impacting.
What do you mean by internal and external stressors?
If we've got some disease, dysfunction, imbalance in the body, that causes the body to be kind of stressed internally. And then there's also
Mm,
external stress, work, life, those kinds of stressors. And both things will impact the body.
gotcha. Is one of those like sticking out more than others? That's as a risk factor?
Yes. So oxidative stress, this is the primary driver of all the root causes, which can impact sperm, egg, everything. And oxidative stress is something that increases or worsens as we age. So the older we get, the more oxidative stress most people have. And oxidative stress causes eggs to age faster, decreases the quality of eggs, the quality of sperm. And so it really can impact all parts of the fertility journey. And oxidative stress is a byproduct of most of our bodily functions, but it's also something that can worsen with obesity or inflammation. It can be caused by toxins or external sources. And it's something that can damage our cells if we have a lot of oxidative stress, which of course is going to impact eggs and fertility and sperm and all the parts that are needed to be healthy
Yes.
in pregnancy.
Gotcha. Okay. So it's like we were talking about stress here, but this is not the same stress that we typically think of. This is
Right.
stress on the cells. And we have antioxidants, which we know are fantastic. We all want more antioxidants. And so the opposite of that, we like to call it pro-oxidants. And we want to kind of, always have more antioxidants and not be in the state. But, eventually if this becomes skewed, now we've got too many pro-oxidants, not enough antioxidants. And so this gap right here is cellular damage, and we're going to call that oxidative stress.
Right.
And as we age, that gap gets wider and wider. Cells slow down, they can't function as well. And that's what kind of causes aging, which is also, of course, the biggest risk factor for,
Yes, exactly.
it's not a root cause, but it's a biggest risk factor for infertility.
Everything gets a little harder and worse off with the older we get.
Is there a way for someone to understand which one of these? Because you listed like 10 things that cause oxidative stress, and this seems
Right.
like impossible to be like, oh, okay, I'll just, optimize all 10 things and, we have this perfect life here in order to conceive. Is there a way, how do you kind of approach that with a patient when they're trying to figure out which source of problems here is causing my oxidative stress?
One of the things we look at is something we kind of call pain, brain, and drain. And that can
Mm,
be, are we having pain? Do we feel exhausted? Do we have brain fog? And this can be really good clue that we're having oxidative stress in our cells. So our mitochondria aren't functioning well and our energy factories aren't working. And so therefore the body is struggling. And so that's one clue that we can have. Certainly we can talk about physical stressors and then external stressors. How is your stress in your life, your work, your relationships, and those kinds of things, which
Mm.
also contribute. And so, having a conversation about symptoms and life experiences can be very eye-opening to what somebody's going through and what might be contributing.
Yep. So we will, when we do that initial evaluation, first we want to kind of make sure that like the conventional stuff has been ruled out, right? So you mentioned PCOS and endometriosis. There could be other problems like fibroids or polyps. So all these like structural issues, which oftentimes are a result of oxidative stress, or because of all the, like the cysts and the abnormal tissue that's creating excess oxidative stress. And so oftentimes we're like, first, if you haven't had structural stuff done, you and spouse, have that ruled out, have things checked out visually, get scans and know if like, just like, all the parts are working, right?
Yeah,
Um,
yeah. That can be the first step with your doctor of, making sure there isn't some kind of a blockage or structural issue. The main things that we're looking at are we ovulating? How are our hormones? Is there, enough of all the right things in all the right places? And so we want to have that appointment with our doctor to kind of have that checked out. But if we find, look, we're ovulating, there's no fibroids, polyps, there's no structural things, then we are going to look a little deeper. And often our clients have kind of done that first step before we
mhm.
see them, typically. But if they haven't, that's where we're going to start for sure.
Okay, gotcha. And then, so assuming that they have done that at the evaluation, now we're also looking at labs and screenings and questionnaires in order to try to decipher, are we having oxidative stress because we don't have enough nutrients, we don't have enough ability to calm down inflammation when it starts. We have some blood markers that we can check that looks for oxidative stress. There's no like this test diagnoses yes or no, unfortunately. It's super complex. And then we also have some screenings that we do that are low cost for toxins. That at least gives us a starting place.
Right.
So those are some things that we will do to try to zero in a little bit more. But we can oftentimes tell just by talking to the patient,
Yep.
right?
Exactly. Some conversations with the right questions can make a big difference. And of course, looking at labs, looking at nutrients, looking at sources of inflammation, looking at hormones, all of these things are important. Looking at markers of oxidative stress, it can also give us another indication if there's a clue. But we also have to look at the male partner as well, right? And often we're thinking about it's just the woman, but 50% of infertility is impacted by the male partner as well. So 20% of infertility cases are solely due to a problem with the male. And 30% of them have some component of both male and female. So therefore, 50% of the time, the male is involved. And so we
Mm,
also have to look at what's going on with our partner as well and their toxic burden and their hormones and seeing what might be impacting them. So, we often just focus on the female, but there's more to it than that.
a good point. It is not all on the woman. And it's great. We do mostly see the women when there's infertility within a couple. And it's so great when we can get the male involved. And we've learned some ways to try to get them involved without them having to see us. Is there another component to infertility that is like less, commonly talked about, like, the male component?
Right, yes, genetics for sure. So a female's egg quality is really shaped by her mother's biology, and that's shaped by her mother's biology. So often infertility can kind of run in families, and it some people are aware of it and some people aren't. I have it running in my family, and I know aunts, great aunts, there's miscarriages and unable to conceive. And so it's one of those things that can be impacted by our genetics. And so things like hormonal imbalances or PCOS, which is a syndrome called polycystic ovarian syndrome, these things can kind of impact generations of families. And so we want to look at that. And is there something we can do to modify or help that in some way as well?
Gosh, yeah. Yep. Do you want to share a little bit more at all about what you experienced with that?
Yes,
You mentioned like it runs in your family.
it does run in my family. And I had this problem, about 25 years ago when there was a lot less information out there. I didn't know that it was something that could run in families. I wasn't really aware of the women before me who had issues because it really wasn't talked about. So I
Mm.
really was unaware that I had a genetic family component at all. And it wasn't until after I went through my infertility journey that I even knew that I had some of these problems because, again, this was really new. So I ended up finding out years later that I did have PCOS, and that was something that ran in my family. But during the time I was dealing with infertility, I didn't know that. I just couldn't figure out what was going on, right? Luckily, I was able to have children, but it is a difficult journey and it really is individual. There can be so many different things that can impact. And a lot of times we're kind of stuck in a box and we're just doing all the regular things. And when that doesn't work, we have to look a little bit deeper. And that's where we're coming in to look at, genetics and men and cell health and those kinds of things that aren't just, did we time it right?
Yeah. Okay. So then I'm sure the listener is like, all right, give me the goods, like let's dive in. I understand I've got all these things going on and that we can do labs and we can, get a good history. What do you do next? How do you actually, what kind of changes can you make to increase your chances of fertility and conceiving and be able to resolve some of this oxidative stress? And then we'll
Right.
talk about like maybe a few patients that we've experienced, what's happened with them.
Right. So one of the things we want to do is look at all of the sources of inflammation in the body and things that are impacting the cells, and we want to reduce or remove those things. And then we really want to make sure the body has all the nutrients it needs. We need those nutrients for a good egg. We need it for a good environment for the egg, for good hormonal response, good balanced blood sugar. And so we're going to look at all of those things in the body and make sure it's functioning well. And then, of course, that oxidative stress and or other stressors we're looking at to reduce those and minimize that impact on the body, and really looking at those hormones carefully. How do they function? And we can bring in things like Dutch testing, which maps our hormones, or a Mira hormone monitor. So they've got some new things now we can look at to help map what really is going on with the hormones. Is this a hormone problem? Is it an egg problem? What's going on here? And so
Yeah.
we can dive a little deeper if we need to as well. And that can be really helpful.
And those tests that you're mentioning, these are at-home urine tests, so very different than, most doctors aren't even going to run sex hormones. But if you do, you're going to just see it in blood. It's going to be one time. They oftentimes won't even tell you when in your cycle to have them done, which is just so tragic. But you
Yeah.
can't interpret these labs without it being on a specific day of your cycle, which is usually going to be halfway between ovulation and menstruation. So
Right.
write that down. If you are talking to your doctor about checking sex hormones, you need to have it done at that time. But the urine testing can give you so much more information about like your total day's worth, not just this one snapshot, and how you're metabolizing it and how you're detoxing it. So there can be super insightful. What else can someone be looking at in order to improve their chances of conceiving?
Well, talking about the man's version or the man's, part of this, there's
Yeah.
analysis, right? We can have them check for obstruction. We can have them check their hormone levels, right? So again, we want to look at all aspects of this and see what we can do to impact that. We also really want to focus on stress reduction, which for me, as somebody who also experienced infertility, I know this is the hardest one because here we
Mhm.
are stressed about not getting pregnant and everyone's saying don't stress, right? And it's like, what? So it really is important to manage that stress in our body and find ways to channel that so that we're not feeling overwhelmed. It's a big component of it. We hear all the time people going through infertility and they don't get pregnant and they stop trying and then they get pregnant, right? And
Yes.
there's something to that, right? That stress really impacts the body and the body's ability to have stable hormones. And
Mhm.
so it's a big one, which of course can be one of the hardest.
Yes, and my husband was adopted. We're adopting, so we're very ingrained in that world, and we see that all the time. That once parents, or once a couple decides that they're not going to keep trying anymore, they're just going to switch to adoption. Once they're like 6 months into the adoption process, and some of them, when they've already matched with a child to bring home, they find out that they're pregnant. They weren't even trying, they weren't thinking about it, they weren't doing anything for it, but they just that let go of that pressure, and now they're having all this hope that they actually are going to have a family, and that puts their body in this state where they can actually conceive. That happened to my husband twins mother as well. It was after about 10 years. She already had adopted two children and then conceived naturally. And we see that with our patients as well. They'll come in being like, all right, I was trying to get pregnant. It wasn't working. I just want to focus on my health now. They set goals around their energy, their labs, losing some weight. And we tell them at the evaluation, hey, some of the things we want to do aren't safe if you were to conceive. So are you doing things to prevent conception so that we can work on these goals? And, they'll be like, oh, yeah, we kind of are, but like, you don't need to worry about it. We've tried for like 3 years. It hasn't happened. You don't have to worry about it. We always get that chat message, right? Like 3 months into it, it's like, so Joy ended up being pregnant. Do we need to change things? We're like, yes, we do. And now we are not going to pursue those goals because they just didn't think it was going to happen. And so I thought it'd be fine to just go outside of whatever their contraception method was. And, it's not a big deal. It hasn't happened in years. And then it does. And we're not even setting that as the goal. We're just getting the body healthier and we're not putting that pressure on there to conceive. And we see that like at least on a monthly basis since
all
we've
the time.
existed.
Yeah. And, sometimes it takes longer.
Mhm.
Sometimes it happens really quickly. Sometimes just some small shifts of nutrients and reducing inflammation can be enough. And sometimes we really, really have to dig a little bit deeper. But
Mhm.
some of these clients that immediately become pregnant as we kind of really change what's happening in their body pretty quickly by addressing those nutrient deficiencies, which are really big when it comes to the cells functioning well. Just putting in a multivitamin for some people can make all the difference if their body was really starved for nutrients and just not quite functioning
Yep.
properly.
Yeah,
And
exactly.
yeah, balancing hormones, right? Getting those hormones on track where it's not like my period's 27 days and then it's 45 days. Like we're getting cycles regulated and hormones regulated. And that, of course, makes a big difference as well.
Yeah, I mean, I would say pretty much all of our PCOS patients that have wanted to conceive were able to conceive. And we're able to get to having normal cycles within like 3 to 5 months or so. Would you say that's been your experience?
Pretty close. I've had some who've had to get help in terms of maybe they need some hormone support, but we've been able to figure out, okay, this is the thing that's missing versus we don't know what's going on or what's impacting us. And we've been able to, use some of these devices like the Mira hormone monitor to track cycles over months to see exactly what is happening and how we can improve that or address it instead of just guessing and kind of throwing darts at it, right? We can really get good information. And so I would say yes, we usually have some kind of an answer or a path forward.
Yeah, we might recommend bioidentical progesterone as a great way to support fertility and be able to continue doing more testing to see if that's the right dose for a person. And then we also have found that we can help patients who are going through IVF as well. And so we've had several patients who have failed one or two or more rounds of IVF and still set that goal of being able to conceive. And we're able to help them get their body to a place where IVF is able to be successful. So even if it's not natural conception or they do need additional support, we can help them with that as well. Because it's just, you never know what the body can do when you give it everything it needs and you remove the stuff that's, really causing it to not feel safe, right? Causing it to not feel like, oh, I'm not sure this would be a great time to bring another life form into this. I need to heal first. And if you can remove those things that's causing the body to be in this protective survival state and add in the things that allows it to thrive, it's amazing what the body can do.
Right. Yes. And being aware of what can impact, what can improve, that can make all the difference too, because you're empowering yourself instead of kind of feeling like a victim or like you don't know what's happening. I think a lot of us spend time trying not to get pregnant. And so when we're trying to get pregnant, we don't think that it's going to be a problem or we don't really consider that it might take some time. And so really understanding how the body functions and what we need to have the body function appropriately can really help us to figure out what might be impacting us on our journey.
Yes, exactly. So to wrap up, we want to do what we can to reduce stress, and we love helping our patients on that because it is this kind of like just intangible, like up in the clouds. Like, what does that even mean? I don't have control over that. there's actually really great research on how to reduce stress and how that impacts fertility. So we have all the studies for anyone who's nerds and wants to have those. We're happy to give that to our patients that we're meeting with. We're going to reduce toxins in our diet and from our gut and from our environment. And we're going to improve nutrient status and balance our hormones. So I think those are some of like the big ones that we help our patients with. And when we do that, we are oftentimes able to get to that end goal. And it's been so fun to see our patients, 9 months later, sending us pictures of their babies and helping them with the breastfeeding process and all of those kinds of things. So,
Yeah. Yeah.
all right. Well, thank you so much for explaining more about infertility today. And please like and subscribe if this was really helpful for you.